Namaskar. Today we'll study the mechanism and side effects of antitubercular drugs. The antitubercular drugs can be classified into first-line drugs and second-line drugs. The drugs with more efficacy and less side effects are called first-line drugs. They include isoniazid, rifampicin, pyrazinamide, and ethambutol. These four are the first-line essential drugs. Some supplemental drugs are there, streptomycin and the derivatives of rifampicin like rifabutin, rifapentine. The drugs with less efficacy and more side effects are included as second line drugs. So when the first line drugs fail, you can use the second line drugs. They include fluoroquinolones like ciprofloxacin, ofloxacin, levofloxacin, aminoglycosides like amikacin, kanamycin, macrolides like erythromycin, azithromycin, cyclopeptides like capreomycin, bleomycin, oxazolinones like linezolid, other drugs like ethionamide, thiacetazone, cycloserine, para-aminosalicylic acid, amoxicillin, clavulanic acid, clofazimine, bedaquiline, delamanid, pretomanid, benzothiazinones. These are all new antitubercular drugs. So to discuss their mechanism of action, please refer to our earlier classes where we have discussed about the protein synthesis, the DNA synthesis, and the cell wall synthesis. So the mycobacterial cell wall, all these are previously discussed in our previous videos. So you can refer to them. You can see here the mycobacterium consists of the mycobacterial cell wall. Cell wall consisting of glycolipid and peptidoglycan or mucopeptide complex. Glycolipid is a combination of mycolic acid and arabinogalactan, and the drugs which affect the cell wall synthesis, they inhibit either mycolic acid synthesis or arabinogalactan synthesis or peptidoglycan synthesis. Then some drugs affect the nucleic acid like fluoroquinolones, rifampicin. Then some drugs affect the protein synthesis by binding to 30S or 50S subunit of ribosomes. So if you see the individual drug and their mechanism of action, and we can see this one, the mycobacterium cell wall. So fatty acid synthase 1 enzyme system forms saturated fatty acid chains of 16 and 24 carbon atoms. Then by fatty acid synthase 2 enzyme system, there will be production of mycolic acid chains up to 56 carbon atoms. They are then esterified with arabinogalactan to form the glycolipid, and this glycolipid along with peptidoglycan forms the mycobacterial cell wall, which is nothing but peptidoglycan glycolipid complex or mycolic acid arabinogalactan peptidoglycan complex. Arabinogalactan is synthesized from beta D arabinofuranosyl 1 monophosphoryl decaprenyl in presence of arabinosyl transferase. So this is the mechanism. Isoniazid inhibits FAS2 enzymes, pyrazinamide inhibits FAS1 enzymes, and ethambutol inhibits arabinosyl transferase. So these three drugs inhibit mycobacterial cell wall synthesis. And if you see the isoniazid actually acts as a prodrug. Isoniazid, the full form is isonicotinic acid hydrazide. It is oxidized by mycobacterial catalase peroxidase in presence of manganese to isonicotinic acyl radical or anion, which forms an adduct with NADH nicotinamide adenine dinucleotide, isoniazid NADH adduct, which inhibits the FAS2 enzymes. Two FAS2 enzymes are there. One is anoyl acyl carrier protein ACP reductase, which is represented by the gene INHA, and second FAS2 enzyme is the beta keto acyl ACP synthase, which is Cas-A, which is expressed by this Cas-A gene. And they inhibit the methoxy, keto, and alpha mycolic acid. So they inhibit the mycolic acid synthesis, and that's why they inhibit the mycobacterial cell wall synthesis. So isoniazid and ethionamide, the second line antitubercular drug, they inhibit mycolic acid biosynthesis. and they have the side effect peripheral neuropathy and hepatotoxicity. Peripheral neuropathy and hepatotoxicity are the characteristic side effect of isoniazid. Then rifampicin inhibits DNA-dependent RNA polymerase. So this you can see from DNA single strand there is formation of messenger RNA by DNA-dependent RNA polymerase. So the single strand of DNA are formed from the double strand DNA by DNA gyrase or topoisomerase 2. So DNA gyrase causes the negative supercoiling of DNA to form two single strands. Then the antisense, one is the sense strand and the other is antisense strand. The antisense strand in presence of DNA dependent RNA polymerase forms the messenger RNA. Then this messenger RNA has the message which protein has to be synthesized, and as per the message of messenger RNA, the transfer RNA recognizes the codon, the 3-base combination called codon or the genetic code that is recognized by the anticodon present in the transfer RNA, these three, and then it provides the transfer RNA at the other end, it has the amino acid. So based on the information available with messenger RNA, transfer RNA provides the amino acids, and those amino acids form the in combination they form the protein. So messenger RNA binds to 30th subunit of ribosome, tRNA binds to the 50th subunit of ribosome. Altogether they form 70th ribosomal complex. Along with elongation factors, there is protein synthesis. So rifampicin inhibits the DNA-dependent RNA polymerase. Aminoglycoside antibiotics like streptomycin, amikacin inhibits 30th subunit of ribosome. The macrolide antibiotics like clarithromycin inhibits 50th subunit of ribosome. Fluoroquinolones inhibit DNA gyrase and inhibit negative supercoiling of DNA. So you can see now rifampicin inhibits the DNA-dependent RNA polymerase, so inhibits transcription, and it has side effects like red, orange color to urine, sweat, tear, and contact lenses because of the color of the rifampicin, that is red, orange color is present in the body fluids like urine, sweat, tear, contact lens. And rifampicin also produces hepatotoxicity like isoniazid. Then the third primary drug is your pyrazinamide, which inhibits FAS1 and disrupt mycobacterial cell wall synthesis. So they inhibit fatty acid synthesis by inhibiting fatty acid synthase 1 enzyme system. Pyrazinamide produces hepatotoxicity. So this is the third first line drug which produces hepatotoxicity and hyperuricemia. So pyrazinamide is associated with side effects like hepatotoxicity and hyperuricemia. Then the fourth first line drug is ethambutol, which inhibits arabinosyl transferase, so it inhibits the arabinogalactan biosynthesis, and the two side effects associated with it is retrobulbar neuritis, causing red-green color blindness, and the other is hyperuricemia. And then the first line supplemental drugs like streptomycin. So the aminoglycoside antibiotics, the second line drug amikacin, they inhibit 30th subunit of ribosome and inhibit photosynthesis, and the aminoglycoside antibiotics characteristic side effect is ototoxicity and nephrotoxicity. Then we have fluoroquinolones, which inhibit DNA gyrase and it produces side effects like photosensitivity and hypersensitivity reactions. Then cyclic peptides like capiromycin, bleomycin, they bind to the 70th ribosomal complex at the interface of small and large subunit, that is 30th and 50th. So at the interface, so suppose this is 30th, this is 50th, so the interface this point, and inhibits the 70th ribosomal complex, so inhibits the protein synthesis. And the side effects again like aminoglycoside antibiotics, it produces ototoxicity and nephrotoxicity. Ototoxicity, that is ear is affected, nephrotoxicity, that is kidney is affected. Then the PABA derivative, para-aminobenzoic acid derivative, that is para-aminosalicylic acid, which is competitive inhibitor of PABA and inhibit folate synthesis. and the side effects are hypersensitivity reaction and gastrointestinal intolerance. So the folic acid synthesis requires PABA. For this, you can refer to our earlier videos on sulfonamides, and the side effects are hypersensitivity reactions and gastrointestinal intolerance. Then cycloserine, it inhibits the peptidoglycan biosynthesis by it is a structural analog of D-alanine, so inhibit D-alanine cross-linking, so inhibit peptidoglycan biosynthesis. For this, you can refer to the bacterial cell wall synthesis or peptidoglycan biosynthesis video. Cycloserine is associated with peripheral neuropathy and CNS dysfunction. Then thiacetazone, again like isoniazid or ethionamide, it inhibits mycolic acid biosynthesis, and it has side effects like ototoxicity and hypersensitivity reactions. So all these antitubercular drugs have characteristic side effects. Linezolid again inhibits the protein synthesis by binding to 23S portion of the 50S subunit, the center of peptidyl transferase activity, and it has side effects like peripheral neuropathy and bone marrow suppression. Linezolid, peripheral neuropathy and bone marrow suppression. Then macrolide antibiotics. Macrolide antibiotics inhibit 50th subunit of ribosome and hence inhibit protein synthesis. Side effects like hypersensitivity reaction and gastrointestinal disturbance. The beta-lactam antibiotic amoxicillin and amoxicillin clavulanic acid can be used. Combination, clavulanic acid is a suicidal inhibitor which potentiates the actions of amoxicillin by inhibiting the beta-lactamase. So amoxicillin inhibits the peptidoglycan biosynthesis at the final step by inhibiting the enzymes transpeptidase and carboxypeptidase, inhibits transpeptidase and carboxypeptidase, and it has also side effects like hypersensitivity reactions and gastrointestinal disturbance. Then clofazimine is a dye product, and mostly it is used in leprosy. Clofazimine has also antitubercular action. It is reduced by NADH and releases reactive oxygen species which kill the bacteria. And clofazimine has side effects like red-brown discoloration of skin because of its color. Because it is a dye, it provides red-brown discoloration of skin, and there is also abdominal pain with loose stool because of the deposition of the crystals of clofazimine. Then the new drugs like bedaquiline inhibits ATP synthase in mycobacterial cells, so it inhibits ATP synthesis, and it shows side effects like QT interval prolongation. Then the other new drugs like delamanid, pretomanid, they inhibit the mycolic acid biosynthesis, but they inhibit only methoxy and ketomycolic acid, whereas isoniazid inhibits methoxy, keto, and alpha mycolic acid. Benzothiazinones, they like ethambutyl inhibit arabinine synthesis and inhibit cell wall biosynthesis. So these are all antitubercular drugs, their mechanism of action and side effects.